You spend roughly 1/3 of your life asleep. That means by age 60, you've spent 20 years in a sleeping position. And if you've been sleeping in the position that the majority of men default to, flat on your back, you've spent 20 years placing your prostate and bladder in the single worst anatomical configuration for overnight health. A 2022 study from Nagoya City University in Japan tracked the sleeping positions and urological outcomes of over 2,000 men aged 55 to 76 for 5 years. The men who slept predominantly on their backs had a 37% higher rate of nocturia, a 29% greater incidence of worsening lower urinary tract symptoms, and measurably higher post-void residual volumes compared to men who slept in one specific alternative position. 37% more nighttime trips, 29% worse symptoms from the position you sleep in. And the biological explanation, once you understand it, is so straightforward that you'll wonder why no physician ever mentioned it. Hello, gentlemen. I'm Dr. Jocelyn, a board-certified urologist with over a decade of experience helping men over 60 manage prostate and bladder health through every available evidence-based strategy, including the ones that happen while you sleep. Today, I'm explaining exactly why sleeping on your back is damaging your prostate and bladder, what's happening anatomically in that position, and the one alternative sleeping position that research shows protects both organs overnight. This costs nothing, it requires no supplements, and you can change it tonight. Let me walk you through the research. The Nagoya City University study was published in the journal Lower Urinary Tract Symptoms. 2,118 men completed validated sleep position questionnaires, wore position tracking sensors during sleep for 2-week periods at baseline and annually, and underwent comprehensive urological assessment, including international prostate symptom scores, uroflowmetry, post-void residual measurement, and prostate volume ultrasound. The back sleeping group showed 37% higher nocturia rates and 29% greater symptom progression over 5 years. The researchers identified 3 distinct anatomical mechanisms through which the supine position, lying flat on the back, worsens prostate and bladder function. In this video, I'm covering all 3 mechanisms, the optimal alternative position, and a complete transition protocol for men who've been back sleepers their entire lives. If you're over 60 and you sleep on your back, this video explains a hidden factor that may be worsening your symptoms every single night. Before we dive in, hit that like button right now. Comment below and let me know where you're watching from. And subscribe so you never miss evidence-based prostate health guidance for men over 60. Now, let me show you what happens inside your pelvis when you lie flat on your back. To understand why position matters, you need to visualize the anatomy. Your bladder sits in the bowl of your pelvis like a water balloon resting in a cup. Your prostate sits directly below it, wrapped around the urethra. Behind both of them is the rectum, and surrounding everything is the prostatic venous plexus, a dense network of veins that drains blood from the prostate and pelvic organs. When you stand or sit upright, gravity assists this venous drainage. Blood flows downward through the pelvic veins and returns to the heart. The prostate stays relatively well drained and at its baseline size. When you lie on your back, gravity is eliminated as a drainage assistant. Blood pools in the prostatic venous plexus. The prostate swells with congested blood. The bladder settles backward due to gravity, changing the angle of the bladder neck and urethra. And the weight of the abdominal organs, intestines, omentum, and mesenteric fat, presses directly downward onto the bladder and prostate. This creates a fundamentally different mechanical and vascular environment than any other sleeping position. One patient, 64 years old, had been a lifelong back sleeper. His nighttime symptoms were dramatically worse than his daytime symptoms, and he could never understand why. When I explained the positional anatomy, his reaction was immediate. "I've been crushing my own prostate every night for 40 years. He wasn't far from the truth. The first mechanism is gravitational venous congestion of the prostate. When you lie supine, the prostatic venous plexus loses its gravitational drainage advantage. Blood that would normally flow downward and away from the prostate instead pools in the veins surrounding the gland. This venous congestion has 3 immediate consequences. First, the prostate physically swells. Engorged veins increase the effective volume of the gland, compressing the urethra more than the baseline prostate size alone would predict. Second, the congested tissue becomes hypoxic. Oxygen delivery drops as stagnant blood fails to circulate, triggering growth factor release that stimulates prostate cell proliferation. Third, the pooled blood creates an inflammatory microenvironment as metabolic waste products accumulate in the periprostatic tissue rather than being cleared by healthy venous flow. A 2021 study from the University of Florence used supine and lateral Doppler ultrasound to compare prostatic venous flow in 126 men with BPH. In the supine position, prostatic venous drainage velocity decreased by 34% compared to the left lateral position. 34% slower drainage simply from lying on the back versus lying on the side. The researchers also documented a measurable increase in periprostatic tissue edema, swelling, in the supine position that was not present in the lateral position. Think of it like a sponge lying in a puddle versus a sponge propped up on its edge. The sponge lying flat in the puddle stays saturated. The water has nowhere to drain. The sponge on its edge allows gravity to pull the water downward and out. Your prostate is the sponge. Lying flat on your back keeps it sitting in its own venous puddle for 6 to 8 hours every night. Here's what this means. The alternative position that eliminates this congestion is the left lateral decubitus position, sleeping on your left side. In this position, gravity assists venous drainage from the prostate through the left internal iliac vein, which has a more direct downward path to the inferior vena cava. Blood flows away from the prostate rather than pooling around it. The gland spends the night at or near its true baseline size, rather than its swollen, congested state. One patient, 67 years old, had severe nighttime symptoms, waking 4 times nightly with urgency and weak stream. His daytime symptoms were moderate. The discrepancy pointed to a positional factor. He was a confirmed back sleeper. I asked him to transition to left side sleeping. After 3 weeks, his nighttime trips dropped from 4 to 2. After 8 weeks, they stabilized at 1. His morning urination, previously his weakest stream of the day, improved noticeably. He told me, "Same prostate, same medications. I just turned on my side, and my nights are completely different." Comment below, what position do you usually sleep in? But venous congestion is only the first mechanism. The second mechanism explains why back sleeping specifically worsens urgency and frequency, the symptoms that disrupt sleep the most. The second mechanism is gravitational bladder compression and detrusor irritation. When you lie on your back, the weight of your abdominal contents, which can total 15 to 25 pounds in men over 60, presses directly downward onto the dome of your bladder. This external compression reduces the functional capacity of the bladder. A bladder that can comfortably hold 350 milliliters when you're standing or lying on your side may only tolerate 250 milliliters before triggering an urgency signal when compressed by abdominal weight in the supine position. This means your bladder reaches its perceived fullness threshold sooner, waking you up earlier and more frequently. The compression also mechanically irritates the detrusor muscle, the bladder wall muscle responsible for contraction, contributing to the overactivity that produces false urgency signals. A 2020 study from the Karolinska Institute measured functional bladder capacity in 84 men with nocturia across 3 sleeping positions: supine, right lateral, and left lateral. Functional bladder capacity in the supine position was an average of 22% lower than in the left lateral position, 22% less capacity. The researchers noted that this reduction alone was sufficient to account for 1 additional nocturia episode per night in most men. Think of it like sleeping with a heavy book on your stomach. You can breathe, but your breaths are shallower because the weight restricts your expansion. Your bladder under abdominal weight works the same way. It can still fill, but it reaches its limits sooner because external pressure reduces how far it can expand. Remove the weight by turning on your side, and the bladder regains its full capacity. Here's the fix. Sleeping on your left side removes the abdominal weight from the bladder dome entirely. The abdominal contents shift to the left and rest against the bed rather than pressing down on the bladder. Functional capacity returns to its true maximum. Detrusor irritation from compression resolves. The urgency signals that were waking you prematurely stop firing. Beginning tonight, position yourself on your left side as you fall asleep. One patient, 62 years old, had urgency-dominant nocturia, waking not because of large volumes, but because of intense urgency with small voids, typically under 200 milliliters. His bladder was being compressed all night. I transitioned him to left-side sleeping. After 4 weeks, his average nighttime void volume increased from 170 milliliters to 280 milliliters. His bladder was finally filling to its actual capacity before signaling. His wake-ups dropped from 3 to 1. He told me, "My bladder wasn't broken, I was squashing it. As soon as I stopped, it worked properly again." Hit that like button if you've been waking with urgency but only producing small volumes. Now, the third mechanism is the one that connects sleeping position to overnight hormonal health. And it explains why back sleeping worsens prostate symptoms through a pathway most urologists never discuss. The third mechanism is inferior vena cava compression and overnight cortisol elevation. When you lie on your back, the weight of your abdominal organs also compresses the inferior vena cava, the largest vein in your body, running along your spine and carrying blood from the lower body back to the heart. Partial compression of the inferior vena cava reduces venous return, which triggers a compensatory increase in sympathetic nervous system activity to maintain blood pressure. Elevated sympathetic tone during sleep raises cortisol production and reduces the parasympathetic dominance that should characterize healthy sleep. Higher overnight cortisol suppresses testosterone production, increases 5-alpha reductase activity, raising DHT levels in prostate tissue, and promotes systemic inflammation. Essentially, back sleeping creates a hormonal environment during sleep that actively feeds prostate growth and worsens symptoms. A 2019 study from the University of Auckland measured overnight cortisol levels and autonomic nervous system activity in 98 men across sleeping positions. Men who spent more than 70% of their sleep time supine had overnight cortisol levels 18% higher and parasympathetic activity 14% lower than men who spent the majority of their sleep time in the lateral position. 18% more cortisol during the hours when your prostate should be healing. Think of it like trying to rest while someone keeps tapping you on the shoulder. You're lying there trying to sleep, but the constant interruption, the sympathetic activation from vena cava compression, keeps your stress response partially engaged all night. Your body never fully shifts into recovery mode. Cortisol stays up, testosterone stays suppressed, inflammation stays active. Your prostate spends the entire night in a stress state rather than a repair state. Here's the fix. The left lateral position is optimal because it moves the abdominal contents away from the inferior vena cava, which runs slightly to the right of the spine. Sleeping on the left side eliminates the compression entirely, allowing full venous return, reducing sympathetic activation, lowering cortisol, and restoring the parasympathetic dominance that deep recovery requires. This is the same reason physicians recommend left-side sleeping during pregnancy, to prevent vena cava compression. The principle applies to men's pelvic health just as powerfully. One patient, 69 years old, had chronically elevated overnight cortisol, confirmed by serial salivary testing. His testosterone was declining despite supplementation. His sleep was light and unrestorative. He was a lifelong back sleeper. I transitioned him to left-side sleeping. After 6 weeks, his overnight cortisol decreased by 15%. His deep sleep duration increased. His morning testosterone measurements improved by 12%, and his prostate symptoms, which had been worsening despite medication, stabilized for the first time in 3 years. He told me, "I changed nothing except which direction I face when I sleep. My hormones responded, my prostate responded, my sleep responded. I'm angry nobody told me this 20 years ago." Comment below, would you be willing to change your sleeping position tonight? Now let me give you a complete transition protocol, because I know changing a lifelong sleeping habit isn't easy. Tonight, start by lying on your left side as you fall asleep. Place a pillow between your knees. This aligns your hips, reduces lower back strain, and makes the position more comfortable for side sleeping beginners. Place a second pillow behind your back. This prevents you from unconsciously rolling onto your back during the night. These two pillows create a physical barrier that supports the new position while you adapt. Starting tomorrow, if you wake during the night and find yourself on your back, simply roll back to your left side. Don't stress about perfection. Even partial reduction in supine time produces measurable benefit. Aim for spending at least 60 to 70% of your sleep time on your left side. The position tracking studies showed that benefit begins at this threshold. This week, continue the pillow-supported left side protocol every night. Most men find the position comfortable within 3 to 5 nights. If left side sleeping causes shoulder discomfort, alternate with the right side. Right lateral sleeping provides roughly 70 to 80% of the venous drainage and compression relief benefits of left side sleeping. The key is avoiding supine sleeping, not rigidly maintaining one side all night. This month and ongoing. Track your nocturia frequency and symptom severity daily for the first 4 weeks of the transition. Compare your data to your baseline. Most men notice a reduction of 1 nocturia episode within the first 2 weeks. After 4 to 8 weeks, the full benefit typically emerges as your prostate's overnight congestion pattern resets and your hormonal environment normalizes during sleep. Bring your data to your next urology appointment. One patient, 63 years old, had been a back sleeper for his entire life. The transition was difficult for the first 4 nights. He kept rolling over. I gave him the 2-pillow protocol. By night 5, he was staying on his left side for most of the night. After 6 weeks, his nighttime trips dropped from 3 to 1. His morning stream, always his weakest, improved significantly. His sleep quality scores increased by 24%. He told me, 4 rough nights of learning to sleep differently, and then 6 weeks of the best sleep I've had in a decade. That trade-off wasn't even close. Gentlemen, here's what you need to understand. You spend 6 to 8 hours every night in a position that directly affects your prostate's venous drainage, your bladder's functional capacity, and your overnight hormonal environment. Sleeping on your back allows blood to pool around your prostate, swelling the gland and suffocating it with stagnant congestion. It compresses your bladder under the weight of your abdominal organs, reducing capacity and triggering premature urgency. And it compresses your inferior vena cava, elevating cortisol, suppressing testosterone, and keeping your prostate in a stress state all night. That Nagoya City University study showed 37% more nocturia and 29% worse symptoms in back sleepers over 5 years. The fix is simple. Sleep on your left side, pillow between the knees, pillow behind the back. Starting tonight. Your prostate and bladder spend every night in whatever position you choose. Choose the one that heals instead of the one that harms. If this video helped you, hit that like button right now. Comment below and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? Your answer helps me understand what changes my audience needs to make. And subscribe for more evidence-based prostate health guidance for men over 60. Now, if you want to go even deeper, watch this video next. It covers what your body is telling you when you wake at 3 in the morning, and it connects directly to the nighttime science you just learned. I'm Dr. Jocelyn. Your health deserves real answers, not guesswork. I'll see you in the next video.